Hi, my name is Regina Williams. I'm a New York-based family nurse practitioner. And right here with me is Dr. Radha Syed.
How are you?
I'm good. Doctor, you're welcome to the program.
I'm privileged to be here.
Oh, man. We are very happy to have you. I am so excited because Dr. Syed comes with a huge, very powerful resume. There you go. Patients are already calling in to tell you or to tell you they're seeing you on our program. We are very happy about that, okay? So please call in. Welcome from Australia, welcome from London, welcome from Nigeria, from all across Africa, from all across the United States. We are happy to have you with us. Okay? Good. Today, bring your husbands along. Bring your husbands, your brothers, your boyfriends, because they tend to say it's about women's health, so why should we be here, right?
That's correct.
Yes, because they are in your lives. They need to know what's going on with you.
And be educated.
And be educated on what is going on with you. So they can be supportive partners in your healthcare if there's need for it. Okay? All right, let's start. Today we're all about women's health. What is women's health? Women's health is a medical term for everything that has to do with treatment and diagnosis of disease and conditions that affect a woman's physical and emotional well-being. Dr. Syed, this is your field.
That's correct.
This is your field. Let's talk about the journey that brought you from, through your education to where you are today.
Sure. So I'm originally from India. I was born and brought up in New Delhi, which is the capital of India, as many of you might know. And I did my medical school there in one of the premier medical colleges. It's called Maulana Azad Medical School. And after that, I joined the Navy.
You joined the Navy?
As a naval officer.
Oh, wow.
As a naval physician.
In India?
In India.
Okay.
And that brought me to Mumbai, which is the premier trade area of India. And there's also the naval dockyard there.
Yes.
And a naval base.
Yes.
And that's where I met my husband.
In the Navy?
In the Navy.
Okay.
He was a captain secretary, he was a lieutenant, and I was a sub-lieutenant.
Yes.
And we met and we got married and we had our son.
And this is your husband up here?
That's correct.
Oh, fantastic.
Unfortunately, in 2016, he passed on. And I miss my partner, sorry.
Oh, that gets you emotional. I'm so sorry.
So, that's all right, thank you.
I'm so sorry.
So when you talk about supportive, he was a very supportive partner in my life and my entire career. My career is independent. Is completely based upon his cooperation in my life. So, in 1977, I gave an exam to come to the United States.
Okay.
My primary objective, like everybody else, is this is the Mecca of education.
Yeah.
It's also the Mecca of technology.
Yes.
And I knew there was far more to be learned
in
outside of India at that time. India today is very progressive and still a third world country, but it has achieved a lot of technology and is foremost in most developed, in the developing countries, foremost because of its technology. And as you know, most of the IT people are from India.
Yes, and so, almost every other doctor is from India.
That's right. So I specialized in OBGYN in India, in the Navy, and through Delhi University, I did my diploma in OBGYN. And after I got board certified there, I came here and I joined a residency in Methodist Hospital. It's now part of New York Presbyterian Hospitals. And I did my residency, and after completion in 1981, I joined a practice in Staten Island where we both live.
Yes, that's fantastic.
Of New York City, one of the boroughs of New York City.
Okay, and that's where you've been till now.
Yes, and further, I specialized in minimally invasive surgery.
Okay.
As well as to all the foremost people, one of the main people who taught me was Dr. Cameron. Is well ensconced in all the literature that you read about minimally invasive surgery. What that means is a minimal access surgery. Instead of opening the belly up, either up and down or side to side, and giving ugly scars, and also delaying healing.
Really,
Doctor.
I'm sorry, doctor. Are we on? Okay. So minimally, you just go through little incisions on the stomach.
Small incisions in the abdomen, going through the umbilicus, which is a port.
Yes.
And through that, we are able to view the pelvic structures much more clearly and in higher magnification.
Yes.
So we can do much better surgery. So that's one of the fields that I liked, and I trained myself on my own. I went all over the world. I went also to Germany, to Italy, to France, and to Belgium, and of course all over the United States. And we've been engaged in not only in learning, but also teaching of minimally invasive surgery.
Which is what we're doing right now. So you
That's
bring out
correct.
your notebooks, there's a lot to learn, okay? All right, so traveling around the world, you do have a lot, you know a lot of languages, you speak a lot of languages?
I unfortunately could not master other languages than the ones I learned when I was a little kid.
Which were?
Which are English, Tamil,
Okay.
Hindi,
Yeah.
Urdu.
Wow.
Yes.
All that?
Yes, that's learned in India. But when you travel outside the country, I could not learn, for example, Italian,
Okay.
Spanish,
That's all right. That's all
or
right.
French. French
Yes.
is very difficult to master.
Yes, but then I have worked with you as a student here.
That's right.
And I have learned so much about, women's health. I was astounded by what I was able to learn under your tutelage. I want to say thank you very much for the opportunity.
You're most welcome.
So I did see that your patient population is across board. There's the Russian, Spanish, Africans, whatever. So you do cater to everybody.
We live in the middle of diversity, not only in New York City, but all around the world. To me, diversity is what I want. I want that. I come from another country, and I smelted myself into this
Melting
culture,
pot.
in the melting pot.
Yes.
So diversity gives me an opportunity to learn different kinds of afflictions which can affect different diverse groups of ethnicity.
Yeah.
So I think it's exciting and challenging to be part of that culture in New York City. I'm so blessed that I practice here, that I'm so blessed that we have all the populations here, amongst whom I flourish because I learned so much from different populations.
Okay, from what you have noticed about caring for Africans, or let me say African Americans in general,
Yes.
are there any specific women's health concerns that you would like African American women or Africans to really be cognizant of?
Absolutely. One of the things which I find is they have a certain category of conditions in women's health which abound in them, just GYN wise, and that is fibroids.
Fibroids,
Uterine
yes.
tumors is very common in the African American population.
Yes.
And not only that, they also have overgrowth of them. Like, it's not just small fibroids, but they have become very huge and very young in their age groups. So I've had the opportunity to treat many of my patients who are African American, and they have benefited hopefully from these conditions which are. So I pride myself in saying I love to do myomectomy, which is the terminology for removal of fibroids in women, and I liked it. That's one of my most favorite subjects.
Yes.
Which we removing fibroids.
We're going to go in depth about that because a lot of the questions I got were from Africans and African Americans talking about fibroids,
Yes.
talking about endometriosis, talking about a variety of illnesses or conditions they notice in their bodies, which I do not have in-depth understanding of, and I'm glad we were able to have you with us to talk about it. But before we go there, can we talk about a few preventative care services and screenings you would recommend, and
Absolutely.
and what you offer in this practice?
Well, screening is different in different age groups, as you know.
Yes.
So the young people, as you know, today's guidelines say pap smear should only be started at the age of 21. Today, pap smear screening for women, any age group, starts with the screening for cytology, which is a different kind of cells which they change from normal to inflammatory to dysplasia, to high-grade dysplasia, and to cancer, and to what is called co-testing for high-risk HPV. We HPV is today about the only cause for cancer of the cervix.
Okay.
So what we're screening when we do pap smear is for cancer.
At what age?
I can start according to CDC guidelines.
Yeah.
Which is American guidelines.
Yeah.
It's at the age of 21.
Okay.
First pap smear is done at that time.
Okay.
And that is a concern of that age group. At the 20 years of old age, you actually have concern about STIs or sexually transmitted infections. The sexually transmitted infections, one of the foremost and most dangerous is high-risk HPV.
Okay.
So we recommend as a part of the screening and preventative care to give injections at a much younger age group before they become sexually active.
Yes.
As you know, the average age of sexual activity may start somewhere at 16
Yeah.
or even earlier. So we want all the children to be vaccinated against high-risk HPV. There's almost 99 to 100% prevention of cancer of the cervix, cervical cancer, but just one shot.
Wow.
One vaccination schedule. So this is called Gardasil, which is a trade name, and now we have Gardasil 9, which covers more. So Gardasil, the first initial Gardasil had coverage for, there are just over 100 strains of high-risk HPV and HPV itself. So Gardasil covered 2 low-risk HPV, 6 and 11 number, and 2 high-risk HPV, 16 and 18, which cause cancer.
Yes.
So now Gardasil injection has coverage for a few more. It's what's called Gardasil 9. There are 9 viruses covered. And the shot is, you do 1 shot today, and 1 shot in 2 months, and the third vaccination is given in 6 months. And that kind of covers, the vaccination is more or less permanent. Sometimes now we're questioning whether it's really permanent, so we may need a booster shot.
Yes.
Earlier in the United States, they were covering from the age of 9 to 26. Now the coverage is extended to age 40. So if you have insurance in this country, you can get the shot free of charge till the age of 40.
And you you give the shots here?
I don't give it because I used to give it. So it was taken over by pediatricians because the age group is so young. So they start from 9 to 13 is the best age to give. So you start way before they would ever get sexually active.
Now there's concern about the HPV vaccinations. People have said, "Oh no, we've seen debilitating side effects on girls and women. That there is a huge campaign against it." But from what you say, if it's almost 99%, preventative of cervical cancer, whatever benefits far outweigh the risk.
Absolutely.
Have you seen like the cases where people have suffered negatively from HPV vaccine?
No, I haven't. And I gave a lot of shots to many people before the pediatricians took over. So I have not seen any. The only side effect they have is
a
injection,
little
bruising at the back and redness. And the other one they have, sometimes they faint because the pain is there. And apart from that, I have seen no side effects.
That's it. So we would do well to get our children vaccinated against
Absolutely.
this.
And they should be educated. Why? Why are we giving the shots? So the sexual education starts at a very young age. So this will also tell the young people, hey, you know what, these things happen. You sooner or later you're going to be sexually active. And this should be preventing. So boys and girls.
Boys and girls
have to be vaccinated. Against HPV.
Yes. Oh wow, fantastic. Why boys? I know that it prevents.
Because Regina, it takes 2 to tango. That's the reason. We need 2 people, and both of them can transmit the infection back and forth.
All right. So some other screenings you offer here, Pap smear.
That's right.
And a few others. Could you take us through the few other screenings apart from?
Well, the STI screen, when we do the Pap smear. Today's Pap smear is not the ones I used to have Pap smear when I first was young. I today offer Pap smears which are consisting of screening for gonorrhea, chlamydia, trichomonas, candida, bacterial vaginosis. So these are basic, which need to be screened for. Because as you know, the fertility potential of a woman is completely destroyed.
Fertility?
By having chlamydia or gonorrhea. and therefore that has to be screened for and treated right away.
Yes.
Trichomonas can cause annoying ping pong infection, which goes back and forth between man and woman.
Yes.
And third thing is bacterial vaginosis, which gives a terrible odor.
Terrible odor. I had like questions about vaginal odor.
But that alone is not the only reason bacterial vaginosis has to be treated. The treatment is required because it can cause devastating infections, which can have consequences which can be pretty tragic. One of them during pregnancy, you can have preterm labor, preterm rupture of membrane, and preterm delivery, which, as you know, is the main cause of infant death in this country, or any country, especially in the third world countries.
Yeah.
And third thing is, if we do a procedure while the person has bacterial vaginosis, it can lead to pelvic abscess. For example, I do a hysterectomy, and everything goes well. On third day, patient spikes temperature. There's a big collection in the pelvis. It's a pelvic abscess because patient was hoarding bacterial vaginosis in the vagina at the time of surgery. So even though we try to sterilize the vagina, but getting rid of this infection, especially by giving treatment which is metronidazole, vaginally or orally, can prevent this horrible complication of major pelvic surgery.
Okay, so there was a lot of questions about which ones are considered sexually transmitted diseases and which ones are not. If you have, there was a question from somebody. She said, if you have frequent yeast infections, does it mean your partner is bringing something home, or can we talk about the sexually transmitted diseases and their symptoms, signs and symptoms?
Sure. So I haven't covered all the sexually transmitted diseases yet. So I'm just talking about pap smear.
Yes.
But if a patient has specific concerns, I would definitely offer screening for herpes, syphilis, and these are blood tests as well as localized tests for cultures, which you can take from cervix, as well as there's ulcer. We can take a culture from the ulcer for herpes. And most of them are molecular DNA. That means you can test it instantly instead of waiting for cultures which may not even grow, or they fail to grow. So nowadays that's easy. The test for syphilis, unless they have lesions, which can be tested with a scraping and sending for bacterial cultures, they should be a blood test, and a confirmation test called Treponema test, which confirms the presence of Treponema pallidum bacteria, which is syphilis. So, and the last and the most devastating disease, which actually not the last, but second but the last, is hepatitis. So hepatitis C, hepatitis B can be sexually transmitted through fluid exchange from the vagina. So when women come together, there can be fluid exchange. So a person is carrier of virus of hepatitis C or B, they can transmit the infection easily to the woman. That's why we really, if I can take away one message from this whole thing, is please have safe sex. I'm not saying don't have sex, I'm saying have safe sex. That means using a condom or a barrier to prevent infections. It can prevent HIV/AIDS, it can prevent herpes exposure, it can prevent syphilis, gonorrhea, chlamydia. You really are doing a big service to this community who are watching you by telling them safe sex is it. If you want to prevent anything, it destroys a woman's future, reproductive potential, and her life. Hepatitis, gonorrhea, chlamydia, and herpes because it gives a stigma, as you know, as well as the fact that there is the most important hepatitis C, which can kill. Recently, we have been able to treat hepatitis C almost completely with a new drug called Harvoni, which is a trade name. But there are two drugs combination, and they can cure hepatitis C. But there are a percentage of people or some genotypes may not be cured, and they can persist and lead to cirrhosis of the liver and liver failure. And more importantly, it can lead to cancer of the liver, hepatoma, and have a need for liver transplant. And one of the biggest problems is we don't have enough tissue to transplant. You know,
Yes,
people
yes.
are not there either from cadaver or live donors
Yes.
who can give a part of the liver or whole liver to who need liver transplant.
Yes.
One of the famous person who made it almost global information. It was Steve Jobs of Apple, who suffered from hepatitis C. No, he developed actually pancreatic cancer,
yeah.
and he developed tumors on the liver.
Okay.
And we found he had to go to Germany
Yes.
and have liver transplant. But the problem is we don't have enough transplant material. So
Yes.
prevention is cure.
Yes.
An ounce of prevention is a pound of cure. So we really have to stress safe sex.
Yes.
And that's where I would.
That's
leave it.
amazing. I hope you are getting a lot of information from here. Send in your questions. I'm online. I can see you. I can see the questions you're sending in. And this is a once-in-a-lifetime opportunity. It's very difficult to catch the doctor. So please send in your questions, okay? Thank you very much, Dr. Syed. Now, you were going to tell us about... before we go into discussing fibroids, which is a major issue with the African American community, with the women in the African American community, you were going to tell us about the changes we would expect in a woman's body from the ages of 20, 30, 40, 50. Now, hormonal changes is a big thing.
That's
Especially
right.
when you're going into the menopause years.
Right.
Okay. And some of us out there are quite frightened because we are not educated on what to expect and how to take care of ourselves. So let's have the doctor talk to us about changes to expect in your body from the time, let's say 30, because 20s, they are young,
Yes.
you know, and we're still taking care of them as kids.
Yep.
Let's start from 30, where you cannot get to shed the weight, get to 40, and you notice your thyroid.